It's Wednesday, August 12th, and time for your Barbados Today morning news update. The body of the late former Prime Minister, Professor the Right Honourable Owen Arthur, will line state at Parliament's buildings for the next 2 days, beginning today. However, the casket will be closed as per Arthur's wishes, Labour Minister Colin Jordan, who is coordinating the funeral, previously announced. Arthur died late last month at the age of 70 at the Queen Elizabeth Hospital, where he had been hospitalized for heart complications. His state funeral will be held on Friday, August 14 at the St. Peter Parish Church, starting at 2 p.m., following which he will be buried at the Mount Pleasant Memorial Gardens. Minister Jordan said preparations are well underway for Friday's state funeral and COVID-19 protocols will be followed.
We are in a public health pandemic, and the protocols that we have set for the public will be observed. There will be sanitizing, there will be temperatures taken, and we expect that people will wear their masks. But we will insist that people wear their masks in the sanctuary and in the sacred locations, and we will expect that people will try to keep some distance between themselves and other persons. We know that lots of people will want to come, and there's restrictions in terms of seating because there's a finite number of seats on the precincts of the church. We believe that we can get some additional seating in, and we are working over the next day or two to see how much additional seating we can get in. So we're inviting people to come. We have a satellite site just to the west at the Esplanade, but we believe that we could get some additional persons in on the compound.
The COVID-19 pandemic is threatening regional plans to eliminate and control infectious diseases, including tuberculosis, HIV, hepatitis, and others. So said the director of the Pan American Health Organization, Dr. Caricia Etienne, who warned that countries cannot delay the fight against the pandemic, but also cannot let the virus delay the region in completing its unfinished agenda of eliminating and controlling infectious diseases.
In October last year, PAHO'S member states committed to a region-wide approach for the elimination of more than 30 communicable diseases and related conditions in the Americas by 2030. The progress to achieving this milestone is now under threat due to the burden of COVID-19 on health systems and the disruption of essential services, including priority disease control programs, elimination initiatives, and routine immunization. Services for common conditions like TB, HIV, and hepatitis are being affected. Over 80% of the countries in Latin America and the Caribbean are reporting challenges in the delivery of TB tuberculosis treatment. If patients skip doses or interrupt their treatment, a manageable condition can quickly turn into an active infection that threatens not only the patient, but also their family and close acquaintances.
Similarly, she said 30% of people living with HIV are avoiding seeking care during the pandemic, and antiretroviral medications are now limited in supply.
HIV is an example of a virus that we know how to prevent and to treat. In fact, several countries in our region have successfully eliminated HIV transmission from mothers to their newborns, which is a major example of the commitment of our countries. But we have data indicating that 30% of people living with HIV are avoiding seeking care during the pandemic, and at the same time, countries have limited supplies of antiretrovirals. This is worrisome indeed, since without continued care and consistent medications, people living with HIV are more likely to become ill and to pass on HIV to their partners. 1/3 of countries in Latin America are also experiencing disruptions in hepatitis screenings that are key for early detection and treatment.
Businessman Ralph Busy Williams is convinced that too much has been made of the COVID-19 pandemic, insisting it was no doomsday occurrence and it can be managed. In fact, the Williams Industries executive chairman and investor is predicting that if handled correctly by the administration, Barbados could see a major economic turnaround next year. He made the comments during an online discussion with other businessmen from around the region, titled From the Frontline, Caribbean Corporate Leaders on the Impacts of COVID-19, which was hosted by the Republic Bank Group in Trinidad. The leading businessman said the crisis has been blown totally out of proportion compared to the pandemic of 1918. He told the online audience that the media had contributed to the global panic about the virus.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To news from the region, the illegal entry of persons from Haiti into Dominica continues to be a cause of great concern for authorities in Roseau, and Prime Minister Roosevelt Skerrit said his government would write to authorities in the French-speaking CARICOM nation about the issue, which he described as being out of hand.
I have directed the Ministry of Foreign Affairs to write to the French authorities so they too can do more to patrol the French waters and join forces with us to curtail this practice, because for us it's also about ensuring that people do not lose their lives unwarrantably in these oceans when they can do otherwise. And I understand the challenges which the Haitian community is facing in these French territories. There are no jobs, the economy has its own challenges, there are limitations. The activities that they will not get involved in by way of employment is on a down low or slow down, like everywhere else in the world and so on. So we understand this, but we have to do it in an organized manner. I intend to meet sometime this week with some of the respectable Asian nationals in country to speak to them and to solicit their continued support in containing and eliminating this practice, so that we do not have a unfortunate circumstance in this country. But clearly we have to take serious, decisive action as a government, as a country, to contain this. It is out of hand.
And finally, President Vladimir Putin said on Tuesday that Russia had become the first country in the world to grant regulatory approval to a COVID-19 vaccine after less than 2 months of human testing. More in this report from Reuters TV.
Russian President Vladimir Putin is saying that his country is now the first in the world to approve a coronavirus vaccine, which is expected to be put into mass production by the end of the year. It hasn't completed clinical trials yet, but the vaccine is being hailed as a Sputnik moment by the country's sovereign wealth fund, Sputnik being the name of the first satellite ever blasted into orbit, which was also Russian. In fact, the vaccine, developed by Sistema conglomerate, is being marked as Sputnik 5 to foreign markets. The vaccine was granted regulatory approval after less than 2 months of human testing, a move hailed by Moscow as evidence of its scientific prowess. But only about 10% of clinical trials are successful, and some experts are concerned at the speed of its approval, who fear Moscow may be putting national prestige before safety. The vaccine still has to complete final trials, which require testing on thousands of participants.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.